Hey doctors, I have a question. What is that thing that dangles in the back of my throat?
Well, that was a great question from Vanessa right here in Anaheim, California. And she's asking about her uvula, right? So what the heck does it do?
It dangles.
Dangles.
Do you want to see some dangle? Here it is.
Yeah.
So when the doctor says, ah, he looks in there, and your uvula will dangle just like that. Well, what is it? It's a small piece of soft tissue that can be seen dangling down from the soft palate, which is right here, above the base of the tongue. And believe it or not, the uvula has its own muscle. It's a big one, musculus uvae, which is a Latin term, obviously, which helps to stiffen, raise, and vibrate your uvula in the back of the throat. And some people have what's called a bifid uvula, which really is the mildest form of a cleft palate. It's one of 5 muscles that make up your soft palate. What does it do? Well, it helps keep food from going down the wrong way when you swallow. If you didn't have it, you could get food come up into your nose or go into your voice box.
And you know what? The uvula can also become infected. It can become inflamed. And with the aid of high-definition endoscopic camera technology, Dr. Sunil Verma from UC Irvine actually takes us inside the body for a better look at the uvula.
Hi, Vanessa. I'm Dr. Verma.
Hi doctor.
So today we're going to get a great look at Vanessa's uvula. We're looking inside of your mouth with this camera. You see your teeth there and your hard palate, and then you see your soft palate, and there's your uvula. It's the dumbbell-shaped object in the middle of the screen. And I want you to say, ah. So you see your uvula muscle there actually reaching towards the back of your throat. Now I'm looking at your uvula from above. We can see the uvula there at the front of the screen, and there's actually your vocal cords. I'd like you to go ahead and swallow some food. Right, keep going. And you see there, so you saw how the screen completely blanked out. That's because the uvula is doing its job. It's contacting the back of the throat, so food goes down the right pipe. As you can see, the uvula has a lot to do with how our throat works.
Cool.
Good old
That's
uvula.
really cool to see it work.
Yeah, absolutely.
You know, the uvula is also pretty important in some languages to produce that guttural fricative sound, like in the Hebrew word l'chaim. L'chaim.
L'chaim.
You know,
You do that well.
You use your uvula for that. Also, singers use it to make that vibrato sound, that up and down wavy sound. The that sound is pretty good.
Yes, you do that.
Thank you very much. I have a very healthy uvula. Yes, you do. So, but here's a little bad news about the uvula. It's pretty rare, but some young people will actually pierce the uvula. Will get a piercing, and the problem is you know, that's a very sensitive piece of tissue with you. It's all part of your gag reflex. Why would you do that?
I don't understand why.
Because it's cool, man.
No.
But who
Because
sees
my
it?
buddy did it.
See it.
Yeah, you can't even see it.
That would hurt.
That's like right up there with
You
one
know,
of the
here's the
dumbest things
problem:
you
is
can do.
they can pull through, and so instead of just having a tiny little
You'll
piercing,
end
now
up-
you have a huge hole.
You'll have
And,
a
Or a
live
and
split.
a thing in your stomach.
Yeah, right. Or your lungs.
Yeah.
You could swallow it or aspirate.
So just say no to your uvula piercing.
Yes.
Yeah, something should not be pierced.
Well, guess what? The uvula is also responsible for this annoying sound. That's right. If your
me?
loved one is a snorer,
that me?
and this guy is a snorer, their uvula is more likely abnormally longer or thicker. But there are surgical treatments for snoring. We've shown them on the show. There's laser treatments to tighten up that loose tissue. There's pillar procedures, just like putting in shirt stays to support that. There's also removing part of the uvula, uvulectomy, to help with snoring. However, you know, we talked about it's involved with voice and swallowing. If you remove too much of the uvula, you may have problems with having hypernasal speech and swallowing problems.
That's why I'm going to go get mine pierced.
I think you need yours reduced.